Hello, this is Neil Myers, Hypnosis Practitioner, with my colleague Bill Miller, Hypnosis Practitioner, and welcome to another edition of Hypnosis Helps. And today we're going to talk about a topic that is one of my favourite topics to talk about in hypnosis, and that's hypnosis in relation to childbirth. Of course, one of the strange things about us talking about this topic is here are two guys talking about hypnosis for childbirth. And I have to confess that hypnosis is very powerful, but neither of us, at least for me it's true, but I don't know about for you, neither of us has given birth.
No.
That's the case for you as well.
Yes.
So we can't speak from direct experience in this particular one. However, in this show we are going to talk about hypnosis and its value in childbirth, and we're going to talk about the experiences of clients, of others, women.
Right.
And we're also going to talk about it from the perspective of the child as well.
Right. So let's talk about this just for a second. We've had this program and we've called it in the past and advertised it as pain-free childbirth. Right. Painless childbirth. And the big point that we were talking is you can have your baby comfortably and so forth. But what we really came upon in discussing it was there's so many benefits actually to the baby.
Right.
And some women might not, even though it's painless and this and that, they just still don't choose it. Whereas if they know what the benefits to the baby are, they might.
Right.
So let's talk about, why don't you talk a little bit about some of the benefits to the mother and then to the
right.
baby.
So again, one of the things that I ask people when we give talks about this is what does the ideal birth look like? Mm-hmm. And of course, I'm talking to mothers to be. And very often, the ladies that come along and listen to my talks tend to be those for whom this is their first child.
Right.
Occasionally, some of the people that come will be people for whom it's a second or even a third child, but the reason they're there is because they want to have a different experience from the one they had before.
Right.
And usually because the one they had before was either heavily medicated or was very unpleasant for them, usually taking a long period of time and involving a great deal of pain.
Right.
So when one looks at that, then if one is looking from the standpoint of the baby, first of all, what would be ideal? Well, one would think that the ideal would be for the mother to be as calm as possible, for the atmosphere to be as calm as possible and loving, as supportive as possible.
Right.
It's hard to think for any of us of a more defining moment in our lives than the time when we emerge into the world for the first time.
Right.
And the world that one emerges into, particularly if one, as most children in this country at least, are born in hospitals and maternity units, is a very different world from the one that we're in, of course. We're in a warm, dark, mostly comfortable place, although it gets a little bit uncomfortable at the end for the babies because they're moving through the birth canal.
Right.
And then we emerge into a world which is, even with the best maternity wards now, which are turning down the lighting, but it's noisy, it's dry, it's scary, there's touch involved.
Right.
We've never even been touched before.
Right.
And if one adds to that the mother, for whom everything, it's to the baby, it is everything at that point. The source of nourishment, the source of love, the source of care.
Right.
If the mother is experiencing stress, discomfort, pain, then that's going to have an effect upon the child.
Right.
So the ideal circumstances would be for the child to be born without any of those things.
Right.
As easily, comfortably, rapidly as possible, when the time is right, obviously, for them to be born.
And so one thing that I'll bring up, and it's probably hard for the viewers to actually believe this, is that in doing hypnosis with you, working with me, and in self-hypnosis, I've actually been back to the womb and gone through the birth process.
Yes.
And it sounds fantastical, but you think about it, the brain is forming and it's recording.
Oh, yes.
Right from in the womb and out.
Absolutely.
And the funny part was I realized the first time what I was going through because I found my body in a very tight fetal position that subconsciously. I wasn't doing it on purpose. And then all of a sudden it straightened out, and I realized I had my hands clamped over my eyes because it was so bright. And so, it can be a harsh experience.
This program isn't going to be talking too much about regression as far as birth is concerned. Bill brings up a very good point. I recently did a regression with somebody, and the trauma came back to birth. And I want to really emphasize to the viewers, when we do regressions, we don't say to somebody, well, now we're going to take you back to your birth because the problems must be there, or any place.
No, never.
We find ourselves there because we basically say we're going to take you back to the first time seen and place connected with these feelings, emotions and sensations that we deliberately stimulate to get there. And we have no idea where that's going to take us.
And to make sure, we're deliberately stimulating them to get somewhere.
Yes.
And we don't want to direct it.
Right.
And sometimes it will take you to the womb.
And I remember a few months ago I was working in Chicago, and I worked with a lady who's a therapist, and she's in her 60s, a very sort of calm, rational person, and I regressed her to this point, and she literally slid off the hypnosis chair. And when people say, when we talk about getting into a fetal ball, we say that, but when somebody's in a fetal ball, they're so compressed and tight. I'd never seen, I mean, if you'd have asked me if this lady could have got into that position, I would have said probably not, but there she was. Really
tight.
She's right there in the womb.
And so you know what? I found the same experience.
Did you?
What I found is that I was doing self-hypnosis and just following the feelings back, and it went there. And all of a sudden my body got tighter and tighter, and your conscious mind is still there, and you see what's going on. And I realized the same exact thing. I said, I don't think if I'm outside of hypnosis, I could possibly make my body get in that tight of a fetal position.
Right, and then that was where the first traumatizing event occurred.
Right.
And as we went through it, it's funny because I spent the next 2 hours lying on the floor next to her, trying to talking to her. It was very odd.
Yeah.
And because I couldn't be up because she was literally down there, very, very small voice.
Right.
And we took her through that, and there was a lot of trauma from the womb.
Right.
And there was a lot of trauma through the birth. And there used to be a whole therapy called rebirthing. There may still be. It probably is. You don't hear about it as much as you used to.
Right.
But it's amazing how much trauma is there. Now, getting back to our processes, we could have the actual trauma that occurs as a result of birth. If the mother was in the sort of states that we know that we can bring them to and they can bring themselves to, that would have been so much lessened and so much easier.
Right.
For everybody concerned.
Right.
And so one of the primary objectives is to give the baby a really good entry into the world.
Right.
We've tended to make the focus of what we do, since probably pain-free and sometimes called painless childbirth has been talked about, the mother.
Right.
Which is understandable, of course, because she's the one that we're working with.
Right.
But, of course, the birth is for the baby.
Right.
It's the baby's entry into the world.
Yeah.
And for that, little person to have the best entry possible.
And you and I have both found with doing regressions with people that that's where a lot of problems can start.
Yeah.
And so the more calm, the more peaceful, the easier it is for the baby, the less chance that you're going to have things that are going to be the start of a trauma.
One of the common things I ask people when I speak to young mothers and mothers-to-be is I ask them what images have they seen of birth.
Right.
It's remarkable how few people that I speak to have either never seen a birth or never seen a film of a birth.
Right.
So mostly what they have seen are what I would call, for shorthand, Hollywood images of birth.
Right.
And those Hollywood images almost invariably include shouting, screaming, crying, these days cursing at the father or cursing at all around, and various other things, very dramatic.
Right.
Now, if you've watched, as I have, film of birth or seen birth, in other circumstances, one knows that it's not always like that.
Right.
In fact, very often, if done differently, it's completely the opposite, but it doesn't make for very good film or television drama.
Right.
So one of the things, even outside of hypnosis, that some people have seen are births which I believe were first introduced in France many years ago, I think as early as the 1970s, and still done today, are births in water.
Yeah.
And one of the striking things for water births is that the children don't really, the babies don't cry. They very, very calmly emerge and calm and rest on the mother. The whole process is very, very calm.
Right.
And the people that were engaged in those births, there's been quite a lot of follow-up studies done, and the health of the children and the mother is remarkable. They're very, very healthy, consistently very, very healthy children.
Right.
And I personally believe that partly that's to do with how they're brought into the world.
Totally, yeah, I agree.
So that's an aspect of it. Now, of course, not everybody can have a water birth.
Right.
Sometimes the facilities are not available. Some people choose that they don't want that. And sometimes it's just not possible for other reasons. But it doesn't mean that the child can't be brought into the world in a calm manner.
Right.
Now, what mitigates against it is, of course, all the ideas that are there initially about birth, and that's the first thing that we talk about.
Right, because like you said, you see the Hollywood movies and it's dramatic.
Right.
And the thing is, it's very natural for the women who do have a more difficult childbirth that they're more vocal about it, and so a new mother will hear a lot of these the bad stories, and not so much the good stories. Where it goes easy and well.
Right.
So they've got all these compounded fears from seeing and hearing all these things that they go in a lot of times with a lot of apprehension.
Yeah, and it's so to contrast two different things, because again, a lot of this, as I explored this field, was a puzzle to me. One of the puzzles, which I'm going to talk about in a minute, is why people that experienced birth using hypnosis, and we're going to talk more about what that exactly means, why they didn't talk about it more. And this was a great puzzle to me for a long, and one of the things I discovered is that, and ladies for out there, I mean, I know it's two men talking, but I think you'll recognise what I'm going to say. There's a lot of war stories about birth.
Right.
People will talk, well, my labour was 4 hours, or my labour was 6 hours, it's nothing, it's 20 hours, the pain was awful. And there's these war stories that are exchanged about birth. And young people hear these war stories, young women, when I say young, I mean children, very often hear these war stories from the very, very earliest times. And so from the earliest times, they have an idea, reinforced by the Hollywood images and everything that we're told, that birth is going to be extremely difficult, extremely painful. In fact, many people are told and accept the idea that childbirth is the most painful thing that anybody can experience.
Right.
Now, we've talked before about pain, and pain is a complex thing. But I remember a story just in connection with this, and with the pain of childbirth, or the theoretical pain that mothers are going to, so they're told, have to have. My brother-in-law at the time, unfortunately, broke his neck. He got a crack of the Jefferson fracture, which is the first vertebra in the neck. He was very lucky. He wasn't quadriplegic or paraplegic as a result of it, and he survived. But he had to wear a halo. And this is one of these things, it looks like a metal cage to keep the neck and head in line. And it's literally screwed into the skull, literally.
Right.
And this is a very painful thing for people to have to wear, extremely. And he had to go for regular checkups, and he was there with somebody else who'd had this procedure in the waiting room, a woman. And they were talking about, the very considerable pain and discomfort. And she looked him in the eye and she said, "Don't let any woman ever tell you that childbirth is more painful than this, because I've had 3 children and I had this, and it isn't even in the same league in terms of," she said to him, "You can look any woman in the eye. You can look any woman in the eye and talk about pain," right? So, and again, I'm not trying to compare one level of pain to another. That's not the goal. I'm just giving the possibility, and we're going to describe how women have had and are having completely pain-free births without the use of chemical anaesthesias, epidurals, nitrous oxide, using true hypnotic process.
Right. And just, I just want to add one more thing about that, because I've talked to different women about this because they're the ones that know the experience. And I've heard something very similar. One woman had a kidney stone, and she'd given birth to 3 children, and she said, "Oh, the kidney stone was really bad. It was worse for her." The other thing she did, we talked about why some women would not elect for painless childbirth and so forth. And I asked her about that, and she actually did mention the war story thing to me.
Yeah.
And she said, yeah, that's very common. First of all, you're apprehensive, and then you feel like it has to be that way.
Right.
And
so this is a common thing. So if you have a young pregnant mother, maybe the first time she's giving birth, and she's very hopeful and joyous and positive, and then perhaps her waters break and she realises that she's going to be giving birth fairly soon. And then it strikes her, assuming she hasn't done any of the processes that we're talking about, all this pain and suffering, this is about to happen to me. And there's nothing I can do about it except certain medications to try and deal with it. It's arrived. And so naturally, if any of us, male or female, was to know that all of a sudden a time had arrived in our lives where we were going to experience extended discomfort, pain, perhaps unbearable pain, then naturally one is fearful of that possibility.
Right.
So there straight away we have enormous fear arising.
So let's talk about that for a second too, because it's not just the painless part that we deal with, or it's better for the baby. Also, we work on those fears.
Absolutely.
When we were preparing for my first child, we took childbirthing classes. One of the last sessions was this older nurse who came in and told horror story after horror story about the cord around the neck, and this I know you laugh now. I was so mad at the time because she was scaring the heck out of all these women.
Yeah.
After that, we came to the final class, and it was kind of half empty. I'm like, where are these people? And honestly, we've heard that one said after she left that, she said, I'm not going to do this. She said, I want to be knocked out. I don't want to know anything. I mean, that's how much fear it generated, which was really unfortunate.
Well, that actually...
So, we worked on that part of it too.
We do. I mean, one of the... we have a website about childbirth, and for anybody watching this, if they can find us and contact us or contact the studio, I hope this is all right with the folks in the studio, we'll send you a video, or we'll send you a link to that video of one of our clients being interviewed about her experience with pain-free childbirth. And this particular lady, lovely young woman, and now has her second child, but she described that she was going to use hypnosis for pain-free childbirth to, I believe it was her aunt, and who was a nurse and given birth to children, and she looked at her very skeptically and said, "Well, you're going to find out what it's really like." Well, she did have a pain-free childbirth, and she describes it in detail on that video, and how it went and what happened, the response of the doctors and the nurses. It's marvellous to watch. Unfortunately, she can't be here today, but when she went back, I asked her what comment did her aunt, I think it was her aunt, and if it's not her aunt, I'm sorry, but what she had to say about it. She wouldn't talk to her about it.
Yeah.
I mean, the aunt wouldn't talk to my client about it at all.
I had a woman talk a similar story because she actually had pretty good childbirth.
Right.
And when she was in this one situation where there was women talking about it, she brought up, "Oh, it was actually pretty good for me," and she was shut down by the other women very quickly.
Right.
And it's really funny like that. So it just doesn't have to be that way. So, but let's talk about, because we keep saying painless childbirth, and I think one thing that might hold some women back is because then they're thinking, I'll have no feeling.
Right.
I'll have no sensation.
Right.
And it's not about no sensation. Actually, you feel all the sensations.
But not
you
pain.
feel the contractions. You just don't perceive any of them as pain.
Right. So there's different levels of this, and this is an important question. There are different ways of giving birth using true hypnosis.
Right.
And we're going to distinguish in a minute between true hypnosis and what we would call creative visualization, which sometimes is called hypnosis, but it's not the same thing. And through the 1940s and 50s and early 60s, when there was a great deal of interest in hypnosis for childbirth, and to some extent it's in other countries, a surgeon called Angel Escudero still uses these methodologies the women are almost in a state of what I would call, not always, but frequently close to general anaesthesia. I mean, it's not general anaesthesia because it's not chemical, but it's a very, very deep state of hypnosis.
Right.
And I think through the 1940s and 50s, a lot of women wanted to give birth in this way. It's almost as if they weren't there, that the baby came out, and then they were brought back, and wow, look
like
at
that woman in the class said, just,
yeah.
I don't even
want to be there, right? I just
right.
And that was very popular, and certainly it's possible to give birth in that way using these techniques.
Right.
And sometimes, when certain instances occur, that's preferable. But these days, most women, I believe, want to feel that they're participants in the birth, that it's a partnership. They want to be present. They don't want to be absent.
Right.
It's a significant event, of course, for the child, but it's a significant event for the mother. In the 1940s, for example, and even in the 50s, and even later, it was rare for the father to be in the birthing room.
Right.
You know, the old image of the father outside, pacing up and down, smoking cigarettes or whatever, you know, waiting for the call, is no longer true. Most mothers want the father to be present. It's a completely different concept of birth. And so the modern methods that we use and the modern conception has to address the idea that the mother wants to be present. She doesn't just want to be completely absent. Oh, I don't know what's happening.
Right.
Now the thing is it's possible using these methods to be present, but without the discomfort, without the pain, at all.
Right.
So
I mean, one of the things is what we talk about is you're actually in an eyes open hypnotic state.
Yes.
And just to be clear, because I do a lot of self-hypnosis, and that's what it essentially are teaching them how to do.
We're teaching a form of self-hypnosis.
Right.
That's right.
And when you're in an eyes open hypnotic state, other than the fact that it makes certain things easier and this and that, you don't really feel that much different than if it's just a normal waking state. No,
except it's the irony is what you don't feel.
Right.
It's like, for example, if we give an analogy, we can be eyes open when we're having dental surgery.
Right.
But we won't feel it. We'll know it's being done. Sometimes we'll feel the movements depending upon the depth of our hypnotic state.
Right.
But there'll be no perception of pain.
Yeah, right. Myself, I had drilling done and filling, and I numb my mouth. So you're in an eyes open hypnotic state. And I felt the sensation of the drill on my tooth, but there just was no pain involved. Right. So it actually was pretty pleasant, compared to it. So a woman given childbirth in this way is going to feel the contractions, she's going to be fully present.
Let's talk about those contractions a little bit, because this is a very important part of it. Contractions are often experienced as and perceived as extremely fearful and unpleasant things.
Right.
Now, there's a combination of reasons. Sometimes the sensation of pressure is much greater than women believed it was going to be. But combined with that is, I believe, this whole concept of what's about to happen is going to be, or what is happening, is very painful and very difficult. And so there's a great deal of fear.
Right.
And when there's fear, then one contracts one's muscles in response to that fear.
Right.
The birth canal the muscles are clamped down upon.
Right.
The overall effect of this is to slow the time of active labour, sometimes for hours.
Right.
Now let's take the opposite. Let's say if the contractions are experienced as pleasant waves of pressure. That contraction is the natural response of the body moving the baby along the birth canal. And when that contraction is there and the baby moves along the birth canal, there naturally follows a period of relaxation of those muscles until the next contraction occurs.
Right.
So if what's experienced is instead, in the first instance, of contraction, fear and clamping down, instead of experiencing contraction and relaxation, increasing levels of relaxation, that baby is going to move along that birth canal much, much, much more easily and rapidly. The mother still perceives the contractions.
Absolutely.
They're not perceived as pain.
Right, and they're not fighting. She doesn't have two sets of muscles fighting each other. Right. One to keep the baby in because of the experience of pain, the other to try pushing it out.
Exactly, and so this comes back to something that you said earlier, and one of the things I caution mothers who've never used hypnosis about is that they may give birth very, very quickly.
Yes.
And you have to let them know that. For example, the average active labour time using the hypnotic techniques that we teach is very rarely more than 30 minutes. Sometimes it's 35. The ladies, some of my clients have, on the tape, the active labour time was 15 minutes, 20 minutes, 25 minutes. Right. The longest that I know of using these methods was active labour of 41 minutes. Right. That was the longest. Now, when you tell these to most women and even to doctors and nurses, they are incredulous. Frankly, they don't believe you. Right. Until they actually see it or experiencing it themselves. And this, I found, is one of the reasons I asked some of my ladies and others, why don't you talk about this? They're not believed. Right. Even by other women. Right. If a woman has experienced 1, 2, 3 or more births and the times have taken an hour, 2 hours, 5 hours, sometimes up to 15 and even longer. Right. And they're talking with their friends about this and somebody pops up and they say, well, what about you? And they say, 20 minutes. They're like, either she's lying or she's a freak. Right. And they don't want to hear anymore. And so they literally, I found, don't talk about their birthing experiences. Right. Because the reactions that they get from others is either that they're lying or flat disbelief, or that there's something really weird about them and therefore there's no point in speaking with them. Right. And so why are these births so rapid in active labour time? That doesn't mean that there might be a period of time when the waters break and a period of time where really not much is happening. But right. We're talking about active labour time. Right. Why? Because there's this process, because they're very relaxed. Now, this is an important point, because if they're so relaxed that nothing's really working, that's not going to work either. Right, exactly. The fact of the matter is that when the baby's ready to come, there is a process that moves that baby along the birth canal. Women have given birth, unfortunately, even in comatose states, where the coma was as a result of injury or. Right. So women have given birth in those states. But we want the state to be such that there is this process where the body is doing what it's doing and the baby's doing what he or she is doing. Because the baby is helping as a partner in the process as well, believe it or not.
I mean, our one client there that's on the tape, she describes it, the doctors and nurses are thinking, oh no, you're a couple hours away or something like that. Right. And she's like, you need to do, check me now. And they're like, no, because they didn't see the pain signals. Right. They're figuring the pain's got to be higher. Oh, you're hours away from this birth. Right. And she's saying, no, check it. Do an internal check. And finally they did, and they were.
The baby's emerging.
Yeah. Right. And they're like, you got 20 minutes all of a sudden. And so you have to educate the doctors and the nurses that you're doing this.
Absolutely.
And it's going to be quicker and so forth.
And that's a really good point, Bill, because that's such a good point. The tendency is the nurses and the doctors measure people's readiness to give birth by a measure of pain. Right. So, for example, they asked my client on a scale of 1 to 10 how much pain you're in, and she wasn't in any. And so they didn't know, so she said, don't worry about it, you're a long way from giving birth. And she was like, okay. So they felt they needed some attention from the medical staff. So they thought, well, in the end, we'll tell them we're in pain, but I'm not, just to get a response. Yeah. So they said, what level? And she said, well, 8. And don't worry about it. They were like,
because they still didn't believe her, because you can tell if somebody's in a lot of pain. Right. You can tell the signals. So you really have to educate them beforehand. Right, and so literally when they asked the doctor to check, they were the baby was emerging, was beyond crowning, and he was shocked, and she gave birth very, very quickly. Right. So it can be such a vastly different experience. And that's what I believe one of the nurses said afterwards. She said that was just amazing. That was one of the best births that she's had, because it was so quick and easy and so forth. And it is better for the baby. Yeah, and this is one of the things that really amazes me. One of the areas where I wish it was possible would be to get the maternity wards, the obstetricians, gynecologists, birthing nurses, more involved in this process. And